What has led to you becoming active in the rare liver disease space?
Yes, I became active in the rare liver disease space because I have a rare disease. I became, during my mandate in the European Parliament, visually impaired. I just see 30%, and that in a very difficult way to explain manner. I came in contact with more rare diseases and also with the rare disease Wilson. And what shocked me is that also small children can be affected by it, and that it's very difficult to diagnose it. And I think that's the main issue with rare diseases is that they are very, very difficult to diagnose, and there's much of non-information on them. And also it depends on each individual what are the symptoms, and sometimes general doctors, they don't recognize that. So it takes a lot of time to be aware what is wrong with yourself. You cannot explain it, doctors cannot explain it until you find an expert. And then you go from expert to expert, from country to country. I myself went from Luxembourg to Germany to France in order to get my diagnosis of neuropathy optic. And yes, it's a relief when you know that something is wrong and what is wrong, but then the disappointment that there is no remedy to it often. But the symptoms can be relieved. Your daily life can be facilitated with some medicine, and that's why I'm active. We have to raise awareness about several rare diseases, or thousands of rare diseases in the world. We have to raise awareness about them, and also about rare liver diseases, because there's also the issue of the stigma when it's related to the liver. And I think that it's very important to inform people about and how to prevent these diseases.
What barriers and challenges exist in Parliament to addressing stigma and health inequities for rare liver disease patients?
What is complex in the Parliament is to, first of all, raise awareness about rare diseases in general, and to explain what they are, how they affect the people concerned, but also their surroundings. And then also to explain what this specific disease causes as side effects. And it's very important here to talk to my colleagues in the European Parliament that this is an issue, rare diseases are an issue that can affect everybody. And the more I talk to people, for example, about my rare disease, that I'm visually impaired due to a genetic defect, then it comes out that they know other people that have also rare disease or another disability. And this is important because as more we are aware that there are diseases, genetic defects, etc., affecting our daily lives, this will also be affect our policy making in the afterwards. So I think that's very important. And I am co-chair of the Disability Intergroup, and their rare diseases are also one of the topics. And it's important to gather on joining forces cross-party with other MEPs, so members of the European Parliament.
What are some strategies that can be employed to advance the agenda on rare diseases?
What we can do as politicians is, first of all, to raise awareness within our institutions, first of all, as we legislate. Secondly, also to raise awareness in society about rare diseases. Very important. Therefore, I support also associations in Luxembourg, and I encourage also the cross-border cooperation, which we as politicians should facilitate. That's very important. Then investment into research. Research is key when it comes to rare diseases. MSS have a rare disease where the genetic defect is, as they say, unique in the world. But I don't think so. It's just that we have to find other cases and gather experience and document it, and maybe then find with joint forces between the continents and most of all between the member states in the European Union to work together and find remedies for this. So investment into research, that's my call on the Commission to go forward with that. We did that during COVID, so let's do that also for rare diseases and the fight against cancer. And I think these are the most important things. And if I say raise awareness in the society, means also that oneself also asks the doctors to screen, to do regular screenings, and also to maybe ask the doctor, can that be a rare disease, so that he can maybe follow also this track. And the most important is in the European Union that we exchange information. It cannot be that every country, every member state keeps the information for itself. No, because we have the right to free movement, and that's what we are enjoying in the European Union. And so we all mix up. We go to different hospitals, have different medical care, and that's what is an advantage, that we can change information between the member states, but we should facilitate that and encourage that as well. And as politicians, we do.
What are the most pressing challenges facing rare liver disease patients today?
That's not easy to answer, because there are a lot of challenges, but I think these are the very important ones. Loneliness. Having a rare liver disease can be very lonely, and patients tell me very often that I'm the only one I know, and that makes that nobody understands what I'm going through. And to be honest, that's the reality for most patients. And then the stigma, and you have to deal with. And that doesn't make it better, because a lot of patients don't dare to talk about that they have a liver disease, and that's very sad. And what about, oh, you look so well, but you don't feel well? How do you explain that? Very frustrating, because nobody wants to hear that somebody is not okay. And then one of the main issues who can't miss in this list is fatigue. Fatigue is very hard to clarify to other people. It's difficult to clarify how different your fatigue is from the fatigue from other people. And for many patients, this is so frustrating. And not to talk about the itch, depressed feelings, concentration problems. You have to deal with it. And the people in your surrounding who don't understand what you're going through. And not to mention the uncertainty about the future, work, family planning, and the fear of the risk of liver cancer. And this is just some of the long list that patients face.
Can you tell us about patient resources and how they can help people understand and manage their diseases?
For all patient organizations worldwide, there is one of the basics of their existence: helping people to understand their liver disease and how to manage it. Understanding and management your liver disease is not easy, and they are two different things. Understanding is a long process done by reading validated information on our websites, leaflets, brochures, etc., and talk about it. Sometimes it can be with experts, and other times with people who are in the same situation as you do, the peers. And that is always very helpful for people. Another thing is management. Managing your liver disease is very difficult because it affects your life that's different now than you were used to. When people phone me, the first question I always got is how to deal with their liver disease. So, can you please give me advice how to ignore it or to make it better? And I always tell people, the first thing you need to do is to accept that your agenda is not anymore in the lead. It's your liver now. And if your liver decides that it's a bad day today, it's impossible to ignore this. And there is a lot to tell about managing your day. You try to be positive and active because everyone is telling you how important that is. But what do you do when you feel so horrible and depressed? We patient organizations have advices, even programs for this. It's very often the low-hanging fruit, but even that can be so difficult. It takes time to find your own routine and the courage to ignore all the best advices from your family, friends, and colleagues. You have to learn and accept that your rhythm of the day is what it is, and that a good day now is not a guarantee for a good day tomorrow. To make that clear to the people around you is extremely difficult.
If you could get one message about patient experiences to policymakers and healthcare practitioners, what would it be?
My important message to every policymaker and healthcare professional is: ask a patient how their liver disease affects their life. Their answer will make you realize why you ever choose your profession. Their answer will make you realize how important your role is in their quality of life. And don't come to me with the comment, "Oh, I would love to ask that, but there's no time." My advice to you is to skip once discussing minor results of blood tests and ask this golden question instead. How does it affect your life? I count on you.